We all have a basic understanding of what mental health is and how it can affect anyone and everyone. We see awareness being raised for this cause and hear about how to be sensitive to those who might relate with it. But something that I and most college students do not really see or hear about is how badly it affects us. Mental health is something that can affect anyone, but for those who go through education, especially in competitive places like the United States, it takes a huge toll on college students. Depression and suicide have been increasingly common among college students because it is a big transition that most are not used to. Students are moving far from home in a new place with no familiarity whatsoever. They are being forced to engage in social events mostly due to peer pressure and the thought of being seen as a loner. Most take on a large workload while working full time in order to pay debt and have a good financial standing. When most students are transitioning into the college life, they can often have a hard time dealing and trying to manage everything and every change that is happening all around them. With the new environment they find themselves in comes access to alcohol and recreational drugs. With the stress and depression comes a need to cope and to feel some sort of relief, which often leads to substance abuse. We all know the effects of substance abuse, which can cause someone to lose everything they have. This is where we see suicide rates increasing with college students.
Despite students looking to substances for an escape from life and to ease any issues, substance abuse actually can lead to many other issues. Substance abuse leads to an increased risk of heart, lung, and liver disease, but also can lead to diseases of other organs as well. Using and abusing drugs can also lead to a higher risk of contracting HIV or AIDS and hepatitis. And while students use drugs and alcohol to help their mental health issues, substance abuse can actually make mental health illnesses more severe, eventually leading to further use and addiction. As substance abuse continues, a lack of sleep and adequate nutrition can further affect success in school, possibly further spiraling a student's mental health.
The constant feeling of unhappiness or loss of pleasure that indicates major depression can result in a variety of behavioral and physical symptoms. These may include, but are not limited to, changes in sleeping patterns, appetite, energy level, concentration, daily behavior, academic performance, or self esteem. Depression can also be affiliated with thoughts of suicide. These symptoms of depression can vary from mild to severe and can be detrimental to the overall well being of college students. Long term effects can also include substance abuse, lack of productivity, and hopelessness. This disorder usually results in extremely harmful mental and physical effects on an individual.
Support groups are an extremely useful tool to utilize when dealing with drug and alcohol abuse. We have previously mentioned that college students can become accustomed to using drugs and alcohol due to social influences or depressive states. Support groups are a great way to help deal with addictive disorders. They influence community and talking with peers who are going through the same issues. Going to support groups brings in new perspective from what others say about their experiences or advice they give. New coping strategies can be learned from support groups as well, giving new alternative methods that could best suit the person in their recovery. It can be intimidating joining a support group, but the benefits outweigh any sort of downfall. Most college students have access to support groups through the universities.
The University of South Florida offers many mental health resources that remain confidential and private for students to use across the Tampa, St. Petersburg, and Sarasota Manatee campuses. These include the Counseling Center and support services for personal and emotional concerns, which offer daily online workshops and therapy assistance online, more commonly known as TAO. USF also provides several crisis hotlines with immediate response to students, which includes lines to the USF Police Department, Crisis Center of Tampa Bay, and National Suicide Prevention. Lastly, USF offers specialty counseling for personalized treatment and specific concerns, such as eating disorders and substance abuse, among others.
Depression and suicidal thoughts in college students is not just a matter of identifying problems, but creating a community full of people willing to help and be helped in order to gain psychological resiliency. In order to combat the number of students dealing with this illness, students need to feel comfortable asking for help, whether that be from peers or professionals. USF offers services and support here on campus, and these services, such as counseling or support groups, need to be made well known to all students. Increased attention through promotions such as posters and flyers placed all around campus makes it easy for students to have access to the help that they may need. It's time to prioritize our students' mental health care.